This study will be presented by Professor Costa, and it's already a study which has involved the University of Perugia. So it's actually a longitudinal study regarding the cognitive decline in people with late onset epilepsy. So when we talk about epilepsy, we talk of a very broad disease, and it can happen in very young people, in childhood, in adulthood, but it can also happen in late adulthood. When we say late onset epilepsy, there's no critical age limit, so there's no threshold which we can use to say this is late onset. We usually think that after 50, 55 years old, we can meet late onset epilepsy. Among these people, it's almost 20% have no risk factors for developing epilepsy. So no stroke, no cerebrovascular disease, no autoimmune process. And these 20% of patients are called late onset epilepsy of unknown etiology. So there is no reason for them to develop epilepsy, although they do. Among these people, we have demonstrated in this study that there is a higher chance of cognitive decline. So this is very important because cognitive decline might be just a second step of a common process which starts with seizures and epilepsy and then later on builds on cognitive decline. In this particular study, we have recruited people with late onset epilepsy of unknown etiology, and our intervention was a deep characterization of all patients. So we performed lumbar puncture to assess the biomarkers of Alzheimer's disease, and we performed longitudinal neuropsychological tests to see how the cognition evolved over time. And what we saw was that actually among our cohort, which was quite large for this particular study, 40 patients, we had overall 10 patients developing dementia. So our follow-up was quite long because it was more than 4 years, but it's very, very important as an isolated data that most of the patients with late onset epilepsy can develop dementia. And this seems to be sustained by a positivity of beta amyloid. So we can say that amyloid may be the shared process between epilepsy and cognitive decline.